The views expressed on this program do not necessarily reflect those of this station. Welcome to Insights into Northeast Michigan. This is a Channel 11 News public affairs program dealing with the issues affecting those in the community as well as Northeast Michigan and the state. And now, Insights.
Welcome to this edition of Insights, everybody. Now, November is National Diabetes Awareness Month. I'm Marissa McKay, and today we'll be sitting down with various staff from the ARMC to learn more about the disease. Joining me first is Dr. Alan Frank, Doctor of Internal Medicine at the ARMC. Now, Dr. Frank, can you just give us an overview and an explanation to our viewers of what is diabetes?
Sure. Diabetes is a medical condition where the body doesn't have enough insulin to meet its needs. Insulin is very important in order for the body to use the nutrition and the energy that we get from our food. In diabetics, they either make no insulin at all, or they make insulin but not sufficient insulin for the size of their body. This leads to a number of medical problems long-term as well as some potential problems short-term.
Okay, and so what are some of the symptoms that people who think that they may be diabetic, what are some of the things that they could be looking for?
When diabetes hits and it's full-blown diabetes, frequently patients will come in complaining of fatigue. They will complain that they're urinating a lot, they're thirsty a lot, they're drinking a lot of water. They may have visual changes as well. Those are some very common complaints. Occasionally we get diabetics that, in addition to the thirst, have very hungry and eating a lot of food. And initially, some of them, for a few weeks are pleased with that because they find that they can eat, 3 times as much food and still keep or lose weight, which is really a bad sign. It shows that their food is not being used at all by their body. But those are the common symptoms when the blood sugars are quite high. Occasionally, someone will come in through the emergency room, their sugars are so high that they're either pre-comatose or they're so severely dehydrated since the extra sugar ends up being eliminated through the urine, and people simply can't keep up with those fluid losses. So with high blood sugar, that can be very dangerous.
Okay, so you kind of touched on this, but let's just review a little bit. What kind of havoc can diabetes wreak to somebody's body and into their health?
That's a great question. Short term, we talked a little bit about the dehydration, which can even lead to coma, and that can occur over a period of a few days to weeks, depending on the type of diabetes. But long term, diabetes is the leading cause of blindness. And even when it's treated, diabetes can lead to changes in the back of the eye, the retina, which cause blindness. That can be detected early and treated and prevented if we know the person is diabetic. It can lead to kidney failure. Diabetes is also the leading cause of kidney failure with people on dialysis or even dying of kidney failure. It greatly increases the risks of heart attacks, strokes. It increases the risks of certain types of cancer. So in most common concern areas for people, diabetes makes almost everything worse. And the longer a person waits to be treated and the less controlled they are, the faster those side effects can occur.
Right, so as you mentioned, there are a lot of things that can affect a person's health because of diabetes, so it's really not something to take lightly, and it is something that people should be aware of. So what are some things, some early detection that you look for as a doctor when you're just treating patients? That's
another great question. What we do annually in people is we screen for fasting blood sugar. And what that is a 10, preferably 12-hour fast where a person would eat dinner and then have nothing except water over the course of the evening, and the next morning have their blood drawn in the morning, and if their blood sugar is above the cutoff level of about 123, then that person meets the diabetes criteria. There are other forms of diabetes where, for example, with pregnant women, we run specialized tests during pregnancy. There's a condition called gestational diabetes where pregnant women are predisposed to diabetes, and that needs to be controlled to protect both the baby and the mother.
Okay, and now there are 2 types of diabetes, type 1 and type 2. So if you could just kind of differentiate again for our viewers what type 1 diabetes is and what type 2 diabetes is.
Sure. Type 1 diabetes is fairly rare. Type 1 diabetes is a lack of insulin-producing cells in the pancreas caused by destruction of those cells. The current hypothesis is that this is probably a viral-mediated autoimmune response. So Usually it's a younger child that catches this. They have the symptoms of just fatigue, very thirsty, a lot of urination. And what's happening is the pancreas beta cells, the insulin producing cells in the body, are being destroyed by the body's own immune system. There's no way to really treat this yet, unfortunately. Fortunately, it's very rare. It comprises less than 5% of all diabetics in the United States.
Okay.
Most diabetics are type 2 diabetics, which you asked about. So about 95+% type 2 diabetics, which is completely preventable. Type 2 diabetes is a situation where the person has some resistance to insulin. That is, their body makes plenty of insulin, but their body gets too big. They eat too much, they don't exercise, in order for that insulin to be sufficient to keep their blood sugars normal. And the bigger they get, the worse the diabetes gets.
Okay, so you did a great job of explaining what the two diabetes are, and you kind of explained who's at risk, but if we could just highlight again for our viewers, who is at risk for type 2 diabetes versus type 1 diabetes?
So some major risks for type 2 diabetes include being overweight, being inactive, having a family history, mom, dad, brothers, or sisters with diabetes, or having a history of gestational diabetes, so a person that was diabetic while pregnant, but then was not diabetic after pregnancy. So
Okay.
Those are the main categories.
Okay, and how many people in the state of Michigan would you guess are diabetics?
There are over 1 million diabetics in Michigan. Michigan's population is approximately 10 million. So over 10% of our population is diabetic. Worse, 2.5 million additional people are what we call pre-diabetes. Their glucose is elevated, but not quite to the cutoff we consider diabetes. So taken together, that's over 1 out of 3 people in Michigan that are either diabetic or pre-diabetic.
So as a physician, this is very concerning to you.
It's extremely concerning. Diabetes raises the risk of almost all serious medical conditions. And in type 2 diabetes, it's very, very easy to detect early, and it is very easy to treat. It's also very easy to prevent through weight loss and through activity.
Okay, well, thank you so much for joining us, Dr. Frank, here on Insights. If you guys stay tuned, next we'll be hearing from certified diabetes educator Perry Green of the ARMC to talk a little bit more about some education. Stay tuned. Welcome back to Insights, everybody. Joining me now is certified diabetes educator and RN at the ARMC, Perry Green. Now, Perry, what is your role for people at the ARMC? What do you do for patients?
I'm the diabetes educator at ARMC. I've been there in that role for about 16 years now. So I manage the program, and our program at the hospital is unique in the fact that it's recognized by the American Diabetes Association, and we're certified by the Michigan Department of Community Health. So what that allows us is two things. It allows us to bill many insurances for the education that we provide, and it also allows the patients to get the reassurance that we're developing and providing a quality program.
Okay, so typically the people that you see, are they already diagnosed with diabetes, or do you see some people who feel like maybe they are predisposed, maybe they are pre-diabetic and just want to learn more? We see both. The majority of the patients we see will have already had diabetes, newly diagnosed. Some have had diabetes for 4 or 5 years. The unfortunate thing with diabetes and diabetes education is that it is the treatment for diabetes. It's a self-managed disease, so patients need to know what to do, how to do it. And the benefit of a diabetes education program or a certified diabetes educator or registered dietitian is we sit down with patients and really develop that one-to-one plan to individualize for them, so that a lot of the myths associated with diabetes and what they can eat, can't do, can be taken care of. Right, so it's a personalized program for
Correct.
people. So, but there are also some group settings that you guys engage in as well at the ARMC that would allow somebody who maybe isn't ready for that one-on-one contact to still learn and still be educated.
Right. Usually when we get we get referrals from physicians, we get community members calling inquiring about education. So when we get someone in, we like to sit down with a one-to-one just to understand their lifestyle, their risks, their challenges that they see, and then from there, from the assessment, we decide whether they'll move on to more one-to-one visits or if they could just get general education from a group setting. But it is all individualized. It's kind of their choice in that assessment process.
Okay, and you did mention that for people who are diabetic who are taking part in your program, their insurance would most likely cover that education.
Within the last the last 6 to 7 years, insurances are paying for diabetes education, and they'll usually pay most insurance up to 5 to 10 hours of education. So that gives us a really good basis to be able to give patients the information they need, get them back in, make sure they're doing okay, and then answer any further questions if they're struggling.
Okay, so how long do you typically see a patient who is newly diagnosed with diabetes? How long would you work with them before, as you mentioned, it is more of a self-treating situation?
It kind of does vary depending on the patient, but I would say on an average about 3 to 4 months. We spread our appointments out so that they don't have to get this large bulk of information all at once, and then we see them back maybe in 2 to 3 weeks and see how they're doing. And it just kind of progresses depending on how the patient progresses and what they feel they need as far as further education, along with what we feel.
Okay, and going back to the insurance now, somebody who thinks that they're pre-diabetic or somebody who's concerned about maybe contracting diabetes, their insurance most likely would not pay for diabetes education since they have yet to be diagnosed. So what are some ways that somebody could still try to prevent maybe the actual onset of diabetes in a less costly way?
Some of the things is to know their risks of diabetes and what the signs and symptoms are. Pretty much anybody over the age 40 should be being screened. And then we do offer support group programs. They're not really, I would say, support group in the fact that they're informational support groups. So every month starting in January we're going to offer a program, and it'll be I think it's the third Tuesday of the month.
Okay.
In which they can come and get educational information, and it's going to be free, and it's going to be held right at the ARMC Health Resource Center Theater.
Okay, and so for somebody at home, so as Dr. Frank had mentioned, there are some issues with children who could contract diabetes just because of the lifestyle at home. So what are some things that parents in the area can do to sort of hold off on the diabetes onset for their kids?
A lot of emphasis, of course, is put on weight, but what we like to do is we like to put the emphasis on healthy eating, healthy lifestyle. So the basic information as far as the 3 meals a day, eating every 4 to 5 hours, more vegetables, all the things that are out there for a healthy eating lifestyle really apply to people with diabetes and prediabetes also. Activity, limiting time, sedentary activity, those type of things. So basically the diabetes lifestyle is a healthy lifestyle. Once they've developed diabetes, parts of the disease make it more difficult for them to lose weight and make it more difficult for them to feel well enough to exercise. So that's where the education comes in, and or medications if needed at that time.
Okay, great. And so you are putting on a program at the ARMC called Debunking Diabetes Myths. So if you just want to give a little overview to our viewers who are maybe interested in attending.
Yeah, that program will be held November 27th. It'll be from 2 to 4 in the ARMC Health Resource Center Theater. It's a free program. We're opening up to everybody. And basically because there are a lot of myths or misconceptions about diabetes, can't eat that, can't do that, shouldn't be doing this, we're really going to open it up as a public forum. We'll have some probably main topics, but we're going to also have people ask us those questions, and there'll be myself there, a certified diabetes educator, and a registered dietitian will be there also. So as a team approach to the management and helping the individuals with their questions and concerns.
Okay, so now let's just highlight a little bit, what are a few of those myths and a few of the misconceptions that you hear most often as in your role at the hospital? What are some things that people are really confused about when it comes to diabetes?
Foods that caused what they've ate has caused their diabetes. That's not necessarily the case. Foods contribute to elevated blood sugars, but it's not usually a cause. Family history, they think that's still old, skip a generation. One of the huge ones is if people are told they're a little bit borderline diabetes. It's kind of like being a little borderline pregnant. I mean, it is diabetes, and they should be seeking treatment at that time. So a lot of those things, people thinking they have to be the Jane Fonda exercise workout people to really impact their diabetes is a misconception too. So we really try to get things simplified, easy, set goals, allow those patients to work towards those goals and readjust the plan if they can't reach those goals.
Right, and you did mention people have a misconception about how much physical activity is necessary. So on average, for the week or for a day, how much should somebody who is diabetic or pre-diabetic be exercising? Well,
with diabetes, because the majority of the people are older or possibly overweight, really movement is what they need to do. A daily movement. It doesn't necessarily have to be that 20 to 30 minutes a day, but just movement more when we set up that plan and kind of go from there.
Okay, great. And in terms of what people will get out of this Debunking Diabetes Myths program, what are some of the main things that you hope patients will, or people who are just interested, leave with?
I'm hoping that more people will take advantage of our actual diabetes program at the hospital. I think anybody getting more educational information and more information about diabetes is important. The more you hear, the more often you hear it, you know, most of the time people come away learning at least 1 or 2 things new, and then it's been well worth it. You know, if it can clarify a misconception about diabetes, and really, you know, bring in that support and promote our programs that we will be beginning in January too.
Okay, great. And who are you guys targeting with this program? Is it just, as you said, it's open to everybody? So are you hoping that just the general public will come, or do you think that people who have a family history, as you said, of diabetes, maybe somebody who is pre-diabetic, isn't exercising, isn't eating that healthy? What do you think that those people should definitely come?
Yes, I think family members of individuals that have diabetes, and people with diabetes themselves, people who are concerned about diabetes or have questions. Unfortunately, we're in a world with very high insurance co-pays and deductibles, so not everybody's going to seek treatment like they should. Understanding where their values and their goals should be for their diabetes numbers. It's just going to be kind of an open forum and ask those questions as we go. So I think it'll be a good informational resource for people with no charge.
Okay, great. And so again, if you could just say the date and the time and the place just for our viewers in case they're interested.
It'll be held November 27th at the Health Resource Center from 2 to 4. And like I said, I myself will be there, and one of our registered dietitians will be there, and we'll be working the program together.
Okay, great. Well, thanks so much for sitting down with me today, Perry. If you guys stay tuned, coming up next on Insights, we'll be sitting down with Melissa Tolan-Halleck of the ARMC, Community Outreach Director, who will be discussing what the ARMC does to try to help our community become more educated about diabetes and other issues. Stay tuned. Welcome back to Insights, everybody. Joining me now is Melissa Tolan-Halleck, Community Education Coordinator at the ARMC. Now, Melissa, thank you for joining me today on Insights.
Thank you.
What is your role at the ARMC?
My role is to be the bridge, really, from the community to the hospital, and assessing community needs, assessing the needs of our community, and then providing programming based on those needs.
Okay, and so one of those needs, as we've talked with Dr. Frank and Perry Green about, is to promote diabetes awareness. So why should our community be concerned about diabetes?
Diabetes is a pretty common and a very serious chronic condition, and because of that, we have pretty high prevalence here in Michigan, higher than the national standard, and we also have a big diagnosis, or big percentage, I should say, of undiagnosed. So it's something that is preventable, and it's something that is very controllable.
Okay, and by people who are pre-diabetic, does that mean that they just pose a lot of risk factors to developing the disease, and if they don't change their lifestyle, they most likely would develop the disease?
Yeah, that's exactly it. If prediabetes is something that the numbers are starting to show that their body isn't doing the right thing with glucose, with insulin, but that doesn't mean they have to develop diabetes. And I think it's a really, really great time to really start changing lifestyle, losing 10% of your body weight can give extreme benefits to your risk factor.
Okay, and so now at the ARMC, it is National Diabetes Awareness Month during November, but you guys are planning on doing something going into the following year as well. So why don't you tell our viewers a little bit about what you guys at the hospital are trying to do to curb this trend of diabetes in our area?
Well, we do several things. As far as for our program in particular, we are doing a monthly diabetes series support group, and that will be led by health professionals, our diabetes educator Perry Green, we have dietitians that work in the program, and myself. So that'll be led by people who are experts in the field. And it's not just for someone who has diabetes, it's for people who are affected by diabetes. And you don't have to be a part of the program, but you can still come to this program and get good, valuable, research-based information. And other things that we do, we're in the community a lot. We're in the community doing health fairs. We're out in the schools doing health fairs, doing education, and all of those things relate a lot to diabetes and diabetes prevention. If we're talking about diabetes, helping with awareness, and then also helping with some of those risk factors, such as overweight, childhood overweight, adult overweight, we are going to decrease our risks. We also, at least quarterly or about quarterly, we do offer some kind of a a forum or a diabetes question-answer forum or a presentation of some sort, and we are doing that coming up here in the end of November 27th. And so that will be at the hospital from 2 to 4, and we'll have Perry there and some dietitians to answer questions and really just kind of help debunk some myths that I know are out there.
Right, and Perry highlighted some of those myths for us, and she also brought up a good point that, and you did as well, that somebody who has diabetes should not be the only person attending this event. So do you encourage their family members, especially if it is a husband, a wife, a brother, a sister, somebody who could serve as a support system? Do you think it would be beneficial for them to be educated further as well?
Absolutely. You know, when we talk about diabetes being something we can manage and something that we can control, and something we can prevent. What that means is that your lifestyle has to be conducive to that. So if your lifestyle is going to be that's of something that's going to help you be more active, eat more fruits and vegetables, eat more whole grains, if you're going to do all of those things, you don't do it alone. It's not sustainable if you're doing it alone, so it really makes sense to have a buddy, have your family, have friends with you.
Definitely. And so going forward, too, in terms of prevention, you mentioned that you guys are out in the schools a lot trying to educate children. So what are some new initiatives that you guys are undertaking to reach out to the next generation of people who could be predisposed to diabetes?
An area that is really a hot topic, and it's a bit sad that it's a hot topic right now, but childhood overweight is growing. It continues to grow. And there's a group in Alpena that has come together. We call ourselves the Healthy Communities Collaborative. And ARMC is very involved in that. I'm involved in that, as well as other vested individuals in the community, such as some of the clinics and some of the other physicians and so on. What we've done through this Healthy Communities Collaborative is we've decided to take a stab at childhood overweight and really improving the health of the families in the community. And so if we're going to improve the health of the families in the community, we needed to have a tool of what that would be. So what we've done is we've adopted a toolkit, and this toolkit is the 5210 toolkit, or the message. And it's really catchy. It's a message.
Right, 5210, yes, let's go, yes.
Exactly. And so what we're doing is we've really started to integrate this in this team that we're working with, and we've labeled ourselves, and we have a logo now that is called the Healthy Families of North on the Sunrise Side. And so with that, this group we're going to be doing training in healthcare provider offices. We're going to be doing training in daycare providers, and really getting out there into the community so that families are aware of this message. So you don't just see it in one place, you're seeing it in lots of places. And that message is really talking about 5 fruits and vegetables a day. 2, you should have no more than 2 hours of recreational screen time, which means playtime. DS, Xbox,
computer,
yeah.
TV. Okay.
I mean, I know a lot of us work and we have to be on the computer,
right.
But other than that, it's we shouldn't be spending that much time in front of the TV. And then 1 is we should have at least 1 hour of physical activity a day. And that can be play, but that should be not just a board game. Board games are good, reading is good, but we need to be active. We need to be out playing and being more active. And then 1, and this is a tricky one, I think that a lot of families are not aware of this, but 1 means, 5210. Mm-hmm. The O is really that we should not be having any sugared beverages, which includes fruit juice. And I think for children, the recommendations are up to maybe a half of a cup in a whole day.
Wow.
So we really shouldn't be drinking, definitely no sugared beverages, but even fruit juices. We should choose fruit over the juice. And so that means lots of milk and lots of water. Well, lots of water and moderate milk. Mm-hmm. And so that's something that I think a lot of families are not aware of, especially when we look at what we're a generation, the teenagers especially and the preteens, are a generation of bottled beverage drinkers.
Yes.
They're getting out of vending machines, they're going to 7-Eleven. This is a real common thing. So so the prevention piece here is really helping families realize this is not something just the child who may be a little bit overweight should be focusing on, or not just the mom or the dad who struggles. It really needs to be a family effort, and it needs to be a community effort, and that's where this whole group of the Healthy Community Collaborative came out of, that we need it to be not just the families. We need to, as a community, embrace it also.
Right, and how long have you guys been doing this out in the community?
Well, we about a year ago started really focusing on this idea, and we're just getting the toolkit out. Some of the first pamphlets and brochures and educational opportunities are just happening even this week.
Right. And,
So
and
it's
how has the
really-
response been so far for that?
It's good. I worked
Good.
with some kids yesterday, a whole school of children yesterday, and it was really, they get the 5210, they get that, and I'm hoping that they get it so they're going home and they're talking to their parents and their grandparents and saying, oh yeah, 5 is this, and then they're just
creating that
talking about
discussion.
vegetables and fruits a little bit more. And going back to diabetes, there is a lot to say. Really, the best thing we can do is to lose weight if we're overweight or maintain our weight if we're not overweight. Because as we age, our risk is going to go up anyway, and children are now developing diabetes at a higher rate than we've ever seen. So it's really, really important that we address it now and that we're taking, not ignoring it because we think it won't happen to me or that's just
Right.
what we do in our family. We're just chubby in our family. I mean, we hear that and we see that.
Right.
And yes, there's a genetic disposition to this, but it's best to address it. It's not something to be ashamed of. It's not something to feel that you can't do anything about. It's something we can do something about. So hopefully this message of 5210 is
Getting
simple
out there,
enough.
right.
Yes, simple
Okay.
enough and straightforward enough.
Well, thank you so much for joining me, Melissa, today, and I hope that you guys all at home did learn something from this edition of Insights. Stay tuned next week as Insights will be hosted by Marlena Hamilton. Thanks for watching.
Insights into Northeast Michigan has been a Channel 11 News public affairs program. If you have any comments, suggestions, or topics you would like to see on a future show, please email us at the web address on the screen. This has been a production of Thunder Bay Broadcasting Corporation. All rights reserved.